Ketamine has exploded into the world of psychiatry. Ketamine is a medication that has been around for over 50 years, and its use has only recently become recognized in terms of its efficacy for the treatment of depression and severe mood disorders that have had little or no ability to be treated from prior traditional medications. So, what is ketamine? Ketamine was made in 1962 and it was FDA approved for anesthesia in 1970. It's extremely safe, and at high doses, it produces dissociative anesthesia, which detaches consciousness from sensation. This enables a person to undergo surgical procedures without basically any other medications, and also preserves the person's cardiovascular reflexes, meaning that they're able to still breathe and maintain their blood pressure despite deep sedation. In 1985, the World Health Organization placed ketamine on its essential medications list, meaning that they felt that ketamine was such an essential medication for anesthetic purposes that it should be available to all countries and possibly not even scheduled, meaning that it should not be a controlled substance. In 2019, the FDA approved a medication called Spravato, which is S-ketamine, for treatment-resistant depression. The history of ketamine is fairly complex. Now, ketamine is actually a congener of PCP, phencyclidine, which was created in 1956. The problem with PCP was that it was difficult to control the reactions of individuals once they got out of an operation, and delirium was effectively a problem. So in 1962, Carl Stevens created ketamine, and this medication was evaluated through a number of different physicians, especially Dr. Domino, in which they utilized ketamine on volunteers and also in surgical arenas, demonstrating the safety and efficacy of ketamine for anesthetic purposes. In 1970, the FDA approved ketamine for anesthetic purposes. And from there, ketamine has continued to be effective and safe through millions and millions of uses of operative procedures, and also with the use of ketamine in terms of its use on military battlefields, where it's used to extract soldiers from trauma that they might have suffered from during a military experience. Now, ketamine is made of a right-handed and left-handed form, just like all molecules. S-ketamine is on the right side of this particular diagram, and the other formulation of ketamine is listed on the left side, the R form. So when we give intravenous ketamine, you're actually receiving a 50-50 mixture of R and S ketamine. Now, the body may prefer one formulation over the other, and Spravato was generated as the S form of ketamine. And when a person receives Spravato, that's all they're receiving. Whereas when you get intravenous ketamine, you're actually receiving a 50-50 mixture of both. Now, in this particular case, each particular side of ketamine has its own advantage, and we find that the intravenous formulation seems to work even better than Spravato in terms of both speed and efficacy. So what conditions does ketamine treat? Well, it does treat treatment-resistant depression quite effectively, bipolar depression, anxiety, suicidal thoughts, social anxiety, and painful disorders such as migraine headaches, cluster headaches, trigeminal neuralgia, CRPS, which is chronic regional pain syndrome, otherwise known as reflex sympathetic dystrophy, obsessive compulsive disorders, and post-traumatic stress disorder. So why should you consider ketamine therapies? Well, the fact is that ketamine seems to produce robust and rapid results in up to 70% of treatment-resistant patients, and it works rapidly within hours to days. The other newer information that has come out is that ketamine can make your underlying medications work more rapidly and effectively. So a single IV ketamine augmentation of newly initiated escitalopram, which is Lexapro, for major depression was shown to have an effect in terms of how Lexapro worked in its ability to work more rapidly and more effectively in individuals suffering from depression. So one way to augment your current antidepressants may be to consider ketamine infusions. We know that antidepressants are slow to work and fail frequently. Traditional medications may take weeks or even months to produce any effect, if they work at all. And only 1/3 of patients receive any type of effect or meaningful response with their first antidepressant treatment. If you fail 2 antidepressant treatments, the chances of failing a third is 90% or greater. And this was shown in the STAR-D trial, which is demonstrated on the right graphically. Antidepressants also have side effects. So we already mentioned that it can take a long time for antidepressants to work, if they work at all. In the meantime, as you're waiting for them to work, you generally feel worse and worse. There's also sexual side effects, loss of interest in sex, as well as something called anhedonia, which is emotional blunting, meaning that the individual has no interest in anything. They don't feel excited. They don't feel necessarily sad. They just don't feel. So there's no excitement, no joy in life, and individuals don't like that feeling. There's also weight gain, which is significant with a lot of the traditional antidepressants. And the final thing is that a lot of the antidepressants don't improve wellness factors such as motivation and a sense of reward. They don't improve fatigue or brain fog, the difficulty in thinking. So when we look in the brain, we have neurons, which are the nerve cells, and we also have synapses, which is shown on the right lower side of the screen, where basically neurons communicate with one another. We have a presynaptic neuron, which is where information comes from, and the postsynaptic neuron, which is where the information is going to. And the space in between is your synapse. And synapses are basically created from areas known as dendritic spines, which are little outpouchings that you can see the arrow pointing to in the mid-screen there. And dendritic spines are important because they connect with other axons of neurons to create these synapses. And this is important because it's involved with learning, memory, and information processing, as well as a number of other mechanisms inside the brain. Now, the importance of this is that ketamine rapidly produces neuroplasticity to improve mood by repairing dendritic spines, which get damaged from stress. Stress leads to a loss of dendritic spines and synapses. So when you look on the left at a normal brain, we'll see a neuron with numerous dendrites sitting on it. And then as stress occurs, for whatever the reason for the stress, we see a loss or a dropout on dendritic spines. This means that there can be fewer connections. So we know that depression is neurodegenerative, meaning that it's like Parkinson's disease or Alzheimer's disease. You actually lose neurons, you lose connections, you lose functionality. And we know that things that cause this include stress, stressors such as physical abuse, sexual abuse, emotional abuse, lack of love, lack of structure, medical illnesses, drugs and alcohol, all of which modify activities of the genetics on a person as well as their metabolic systems to produce the experience of depression. Other things that can also produce depression and this neurodegeneration includes inflammation and aberrant neurotransmitter cycling, which can result from this. We know that metabolic conditions in the periphery, such as obesity and heart attacks and stroke and smoking and alcohol, can all cause a metastasis of inflammation and metabolic processing errors inside the brain as well to produce depression. And as a result of all this stress and medical complications, we see fewer dendrites, fewer synapses, fewer neurons, and a loss of supporting brain structures. The end result is cognitive functioning declines. We get brain fog. We have less ability to have executive functioning, to make decisions, to process information, or have insight or impulse control, so we can make bad decisions. So the chronic stress decreases dendritic spines, it decreases neuronal connections, and it damages the circuits inside the brain. So we know that depression results in damaged neural pathways. And we can see in this diagram that a normal neuronal cell has a number of dendrites on it. Chronic stress, where the arrow leads to in the middle of the diagram, shows basically decreased dendrites, and the ability to have connections results in fewer connectivity and loss of circuits, which results in basically a number of cognitive distortions that we see with depression, as well as mood disturbances. It's been found on functional MRIs in individuals who are depressed or have specific mood disorders that there's actually a loss in brain volume, and that you can actually see a smaller area in the prefrontal cortex, hippocampus, and several other key brain regions in individuals who suffer from long-term depression. And what's important about this is it testifies to the neurodegenerative aspects of depression and the importance of treatment and rapid improvement of a person's depressive experience. Studies by Gorwood in 2008 demonstrated the neurotoxic nature of depression and that it causes cognitive scarring. People actually lose the ability to have delayed recall or verbal memory, somewhere along the line of 2% for each episode, based on some 8,000 studied participants. So the more episodes of depression, the more cognitive scarring and the loss of the ability of an individual to basically have verbal memory. So as a result, we get brain fog, we get fatigue, we get low motivation, we have difficulty remembering things. So what is important about rapid and effective treatment of depression? Well, we lose motivation and reward with depression, and it's important to keep those up because that's what makes us want to go to work and do things. Otherwise, we end up with poor work performance, poor social performance, loss of job, loss of finances, loss of the family because of irritability and agitation and bad decision making. Also, we know that traditional medications are slow and frequently ineffective and produce numerous side effects, such as anhedonia and weight gain, and they don't help with core symptoms such as fatigue, happiness, feelings of worthlessness, self-esteem, or other aspects. There's also an association of depression with medical illnesses, such as heart attacks and stroke. And so an individual who is depressed could potentially have a 10-year loss of lifespan, not due to suicide, but actually due to metabolic complications that result from changes in metabolism due to depression. There's also the risk of addiction disorders, such as opiate use disorder and alcoholism, which are all increased in mood disorders. And one other aspect is that the brain ages significantly faster in individuals who are depressed. And this has been studied by changes of sirtuin activity that's been noted in individuals with depression. Traditional medications, such as Prozac or Lexapro, they interact with the monoamine system, which is serotonin and dopamine. And everybody knows serotonin is the molecule of happiness, and dopamine is a molecule of motivation and reward. Ketamine interacts with the glutamate system, which represents over 60% of the neurotransmitter load in the cerebral cortex. Glutamate is a molecule of learning, and it's important and necessarily needed for an individual to learn. It's what allows synapses to form. So mammals have cerebral cortexes, and they have glutamate in those cerebral cortexes, and that's where learning comes from. Whereas things like serotonin and dopamine are involved more secondarily with mood in terms of the sense of happiness and motivation, but their actual presence is sculpted by the presence of glutamate. In other words, glutamate controls the way that serotonin and dopamine works. So we can see that glutamine and glutamate are complex molecules in terms of how they interact with our synapses and inside of our brain. It's been recognized that neurons play an important role, obviously, in learning, but at the synapses, there's also support structures such as astrocytes, which are involved with maintenance of the synapse and the way that the brain functions and the circuits as well. And these cells and these supporting cells, such as astrocytes, are involved with glutamate cycling, which is shown in this particular slide, in which you can see glutamate passing into this upper cell, which represents a supporting astrocyte. And it passes this glutamate back and forth to the presynaptic neuron and out of the synapse and back and forth. So it's been found also that aberrations in astrocytes and microglia inside the brain, which are supporting cells, are also noted to have an impact on mood disorders. And some of this has to do with glutamate cycling. And glutamate, as we mentioned, is one of the neurotransmitters that is impacted by ketamine. So we know that stress affects the brain. It decreases dendrites. We see in this image here a neuron where there are dendrites present on a neuron on the left. And we see this is a no-stress animal and normal dendrites. But with chronic stress, there's a dropout of these dendrites. And what has been found is that ketamine infusions allows the rapid regrowth of dendrites, which increases connectivity. This is what we call neuroplasticity. So how does ketamine work in the brain? Ketamine blocks a particular receptor in the brain called the NMDA receptor, found in areas of the cortex, and it produces a brief glutamate burst in key areas of the brain. This results in the production of brain-derived neurotrophic factor, otherwise known as BDNF, and other neurotrophic factors as well. These are molecules involved with the growth and connections of brain cells or neurons. So with the presence of BDNF, we get rapid dendrite formation and neuroplasticity. That is the formation of new synapses and connections. And this allows for the repair of brain circuitry. So ketamine's actions are complicated, but it primarily affects the glutamate system. And in this particular diagram, this is just a brief attempt at kind of describing diagrammatically what glutamate does. And we won't go through the entire complexities of this, but effectively what ketamine does is by altering the glutamate cycling and the way that glutamate interacts at the synapse, it allows the production of key proteins that allow for synaptic plasticity or new synapse growth. So what has been found is that ketamine, through specific dosing, allows for neuronal repair and synapse formation and dendrite formation, which improves mood. It's been found that through sequential serial ketamine infusions that we can get improved results in depression and anxiety disorders. And in one study by Sharoma in 2016, that basically with each sequential ketamine infusion, that there's an improved response in depression. And so we have found, even in our own clinical practice, that sequential ketamine infusions are highly effective, and that the more ketamine infusions the person receives, the better their response and the longer the remission. Serial ketamine infusions also are very helpful in key areas that are not affected by traditional medications. In one study here by Sharoma in 2013, it was demonstrated that ketamine didn't just make a person feel less sad or less emotional, but also ketamine improved wellness factors such as calmness and energy and happiness and hope. And it decreased fatigue and tiredness and sense of worthlessness. And also it decreased worry as well as sadness. So again, the depression experience isn't just one of being tearful or sad, but also cognitive loss, as well as the loss of wellness factors such as basically energy and self-esteem and motivation and reward, as well as cognition. These are all improved over time with ketamine. So, are you a candidate for ketamine therapy? Anyone can receive ketamine therapy if they're medically cleared from certain disorders or conditions. You can't be pregnant to receive ketamine therapies. If you've had a heart attack or other cardiovascular conditions such as stroke or peripheral vascular disease, you would need a medical clearance. If you have liver or kidney failure or have had a kidney transplant, you would need a medical clearance to receive ketamine therapies. And also, if you have uncontrolled diabetes or blood pressure, they would need to be placed in control before you could receive the treatment. And of course, schizophrenia would be another condition that ketamine would not necessarily be helpful in. We know that ketamine produces rapid response for depression and mood disorders in over 70% of treatment-resistant cases. And we frequently get remission or significant improvements in individuals who have suffered a prolonged mental health journey. And we could see these results within days of the start of treatment. When do you expect to see improvement with ketamine therapies? Well, we have noticed that individuals can notice a change in their mood within hours of the first infusion, but more frequently, it's within the third or fourth infusion that improvement is seen. And each case is different. But how do we monitor or how do we assess improvement? There are a number of medically validated indicators of depression, such as the PHQ-9 or the Hamilton Depression Score, the MADRS score, or a number of instruments, all of which we use at Nova Health Recovery for effectively monitoring individuals and their improvement during these ketamine series. And of course, there are a number of personal and individual assessments that a person may notice, such as a sense of lightness that they feel, or just increased hope, or just general increased happiness and feelings of hope and less negativity that people may be able to describe to us, but these aren't really things that could be noted on an indicator of depression or in a traditional scoring mechanism. For other patients, their family members may notice the changes of ketamine infusions more so than the individual themselves. And they may notice increased interactions and happier interactions by the person who was formerly shut down and depressed. So as far as getting ketamine infusions, are there medications you would need to stop before your infusion? Well, we recommend basically that the individual maintain their medications, but if they can minimize specific ones such as benzodiazepines, such as Xanax or Klonopin, that would be best, because there are some interactions of ketamine with specific medications. Not interactions in terms of side effects, but that some medications such as benzodiazepines or even Lamictal may make ketamine therapy slightly less effective. So in a study listed on the right, more recently in 2021, it was demonstrated that benzodiazepines can somewhat decrease the efficacy of ketamine infusions. What we have found is that just higher doses of ketamine and more frequent infusions seem to work quite well with these individuals. And the same thing with Lamictal. We have not seen as much of an interaction with patients on Lamictal, and have in fact started Lamictal in patients who are undergoing ketamine infusions just to help assist them in specific areas of their mood. In general, we just recommend that the individual continue their current medications for the treatment with ketamine infusions. So we know that ketamine therapies can enhance effectiveness of traditional medications. So there are two studies listed on the right, one where IV ketamine was used to augment newly initiated escitalopram in patients with treatment-resistant depression and major depression. And effectively what the ketamine did was it improved the results and the responsiveness to the escitalopram, and it also made it work faster. And also in a study listed below, and that one was done in 2018, which oral ketamine was used to basically accelerate the response of traditional medications in patients with major depressive disorder. So we have found that as well, that initiating antidepressants and doing ketamine infusions on individuals or changing their medications while doing the infusions seems to make these medications work faster and better. Side effects of ketamine therapy include nausea and vomiting during the infusion. That's probably the most common thing that we see. And this can be decreased with prophylactic medications such as Zofran or Phenergan or something else. And of course, during the infusion, these can be administered as well. A lot of people complain of dizziness and vertigo during the infusion itself. And we frequently will use scopolamine patches to decrease those effects. And of course, anxiety as well. A lot of individuals will basically feel a little bit anxious because of feelings that they get during the infusion. So what we discuss with patients are grounding techniques and reframing the fears or redirecting thoughts, which can be helpful if the person is prepared ahead of time prior to the infusion. In some cases, we can just slow the drip down or stop the IV infusion to help diminish these feelings. And from time to time, even an injection of Versed, which is a benzodiazepine, may be needed to help the individual. Other issues that we see can be blood pressure and heart rate elevations during the infusion. And these are generally very slight, and they can be treated easily with clonidine, or they can just be monitored. And the final thing is balance issues. Most patients will have vertigo briefly and then some sense of balance being off for several hours. And this is why it's important to have a driver for you. You cannot drive after an infusion. So we administer ketamine intravenously through small 24 gauge catheters over 40 to 50 minutes. At our center, we utilize a cold spray or even topical numbing for those who are a little bit fearful of IV needles. Generally speaking, we use 0.5 milligram per kilogram up to 1 milligram per kilogram, and that's ideal body weight. And those are actually infused over 40 to 45 minutes. So we generally start at the lowest therapeutic dose, and then we escalate with each infusion. This allows the individual to kind of adjust to the sensations and feelings that they may have, and it makes them a lot more calm. Usually we do the infusions 3 times per week, but twice weekly are also effective according to studies. The one listed on the right by Singh and his colleagues in 2016 demonstrated that twice or 3 times per week is effective in ketamine infusions for depression. Other questions that we frequently get asked are, do I need to dissociate for ketamine to work? And studies demonstrate that dissociation is not necessary for effective ketamine therapies. A systematic review listed on the right demonstrated that basically there's not a huge correlation between a dissociative nature of ketamine and its outcomes. So dissociation is not necessary. And also, the question of dissociation was evaluated through observational studies, which also demonstrated that there was an excellent safety profile for intravenous ketamine, but that there is no association of dissociation and treatment outcome. So we don't have to go super high. We don't have to make you basically aim for the moon in order to get better. And then Carlos Zarate and his group in 2020 also did some work on whether floating was necessary. And floating basically is a situation where the individual is feeling a sensation of being freed from its body or their body, and that they would effectively float during the ketamine infusion itself. And data from multiple randomized trials demonstrated that there is no interaction with floating in outcomes for ketamine therapies. Carlos Zarate also evaluated the role of dissociation in a systematic study as well. And again, multiple sources demonstrate the same thing, that dissociation is not necessary for ketamine to work. So what does the ketamine experience feel like? Well, we generally feel numbness and heaviness in the face and arms, with visual distortions, enhanced colors and shapes, alterations in auditory perceptions, feelings of floating and connectedness, bizarre thoughts, and feelings that they're shrinking or enlarging. And then there's connectedness and synesthesia. Synesthesia meaning you can maybe feel the color red, hear the color green, or taste middle C. So how do you prepare for your ketamine infusions? Well, set and setting are really important. The environment needs to be calming, and it needs to be a safe feeling. You need to feel relaxed. So you want to clear your agenda for the day. Focus on yourself and your needs. Bring a weighted blanket, bring headphones, bring ambient music with yourself, especially music that you might not be familiar with. Try not to eat the 2 to 4 hours before the infusion, and that will significantly decrease any nausea. And lastly, have a ride for home. Certainly you can reach out to us, Nova Health Recovery, Ketamine Infusion Center, and the information is listed here. If there's any other questions or any other information you need, you can certainly email us and go to our website.